So welcome, my name's Fiona Jones. I'm one of the librarians at the University of Newcastle Library, and I have Jennifer Go, one of the other librarians with me, who is going to be keeping her eye on chat. So if you have any questions or comments as we go along, please feel free to put them in there. I'd like to acknowledge the traditional custodians of the lands on which the University of Newcastle campuses stand. We have the Awabakal, the Darkinjung, Biripi, Worimi, Wonnarua and Eora nations. We pay respects to elders past, present and emerging. I extend my respect to any Aboriginal and or Torres Strait Islander peoples here today, or who are watching this recording. And I'm just going to go ahead and hide my video now, just so that you'll be able to see my screen, the slides on the screen really well, in case there's anything interesting there that you want to be able to see. So this is what the webinar is going to be covering. We're going to look at what is a systematic review and what are other types of reviews, an overview of the systematic review process, how to develop a research question, other steps in the planning process when you're doing a review, and then planning a search strategy. So you can see that it is going to be quite a high level overview of the process and planning, and is going to be quite theoretical. So I do want to make this as practical for you as possible. So please do put your questions in the chat, and Jennifer will stop me anytime that she needs to, so that we can answer questions that come up. And while this webinar is using a health sciences focus in the examples, the information is relevant to anyone conducting a systematic review or a similar project. So you need to conduct a review. So often students are required to conduct a systematic review or a modified version of a systematic review for an assessment task or as part of higher degree research. But what even is a systematic review? So we're going to look at an example systematic review that's been published and use it to identify some key features. So the Cochrane Handbook, they set out a few criteria or examples, features of a systematic review that should be present. The first one is they should have a clearly stated set of objectives, so a clear goal of what the review is trying to do, with predefined eligibility criteria for the studies that they're looking at. They should have an explicit reproducible methodology. They should have a systematic and comprehensive search that attempts to find all the studies that would meet the eligibility criteria. They should assess the validity of the findings of the included studies, and they should have a synthesis and interpretation of the findings of the included studies. So what's happening with the systematic review is you've got a specific goal or objective, you're trying to answer a specific question, you're looking for all the studies that will answer that question and fit your criteria of what is included. And you need to do that in a systematic way and in a way that's transparent, so that someone else can see exactly what you did and can reproduce that if they'd like to. So we're going to look at an example, which is this one, the association between physical activity and mental health during the first year of the COVID-19 pandemic. So this is the full text of that article, and it's an open access article, so it's perfectly okay for me to show you the full text of it here on this webinar and in the recording. And you can see that at the beginning it has an abstract with different sections that outline what has happened in their review. And right at the beginning, in the introduction of their abstract, they tell us what their goal is for this one. This systematic review aims to examine the association between physical activity and mental health during the first year of the COVID-19 pandemic. They've got a really clear objective. And then in this background section, so a little bit of an introduction to what they're doing, they go into a little bit more detail. So towards the end here, they say, therefore, our systematic review aimed to update these findings. So they talk about a previous review that was done and they want to update their findings and clarify if physical activity is associated with mental health. And so that's their clear objective there. Then in the methods section, they tick off a lot of the other important features that we're looking for in a systematic review. So they outline the way their review was conducted so that it will be transparent to whoever's reading it and reproducible. They say here at the beginning, this systematic review focuses on peer-reviewed journal articles. They tell us that they undertook a broad search. They tell us the date they conducted the search and what databases they searched and what search terms they used. They tell us here how they selected, which studies they included in their review and what the criteria were. They talk about how they extracted data. So data extraction was completed independently by one co-author. Data extracted included study details, participant characteristics, and so forth. They talk about how they assessed the studies using a risk of bias tool. And then they talk about how they synthesized the results. So they explain that it wasn't possible to conduct a meta-analysis, but they compared findings across the articles according to each outcome that they were looking at. So you can see that this example review is meeting those features that we're expecting to see. So maybe you're not actually doing a systematic review, but maybe you're doing another type of review. Each type has a specified process and specified requirements, but they do also have a lot of things in common. And the techniques and tools that we're going to look at are relevant across a lot of different review types. So a literature review is what you usually see at the beginning of a research article or a thesis as part of the introduction. It gives an overview of a particular research topic. So it tells the reader what research has already been conducted in a specific research discipline. And it is often used to identify the research gap that the present study is addressing. Scoping reviews follow similar procedures to systematic reviews, but often they're not addressing just one specific question. Often instead, they're actually scoping out what research exists on a particular topic. So just trying to see, is there a lot of research that's been done or very little? Has all the research been focusing on a particular area and leaving another area undone? And for this reason, they're often broader than a systematic review and they can sometimes take longer as well. In contrast, a rapid review compresses the systematic review process in order to summarise the evidence when answers are needed quickly. So if there's a new drug that's been developed and there are a number of studies that are starting to compare the efficacy of that drug with another drug, then someone might want to do a rapid review early on to synthesize the results of those early studies to give a quick answer and what we know so far about the effectiveness of the new drug. A meta-analysis often goes alongside a systematic review. So you'll see the title of some systematic reviews say they're a systematic review and meta-analysis. And that's used when there is quantitative data. So it allows you to compare the effects found by the individual studies with one another. So you can see in this study, it very strongly showed that this new drug was effective, whereas in this other one, there wasn't a significant result. So you can compare from one to the other, but you can also pull the results together to identify an overall answer. So you can say, yes, based on all these studies, when we put all the results together, overall, we can see that this new drug was significantly more effective than the other one. So as you can see, a lot of the language I've been using when I've been talking about this has been health focused. And that's because the very first systematic reviews were designed to look at the effectiveness of patient interventions. But the same methodology, the same idea of having a clear objective and question, searching for all the studies that answer that question, and then synthesizing that all together into an answer, that is being applied across many different disciplines now. And the methodology is adjusted to reflect the different sorts of research questions that you face in different disciplines. And there are many more review types as well. Now, before I continue, I'm just going to pause to see if there are any questions that I should be answering.
The only question was from Nat, which would be, will the slides of this PowerPoint presentation be available after the webinar? So I think we can send them out with recording if you're happy to send Ben your presentation.
Yeah, absolutely. I can organise that so that there's a PDF of the slides that comes out with the link to the recording. Absolutely.
And that's it. There's no other questions.
Okay, thanks, Jennifer. All right, so let's look in more detail at the systematic review process. Now, this diagram, I hope the text is large enough for you to read, shows you the process that takes a team of researchers months to work through, from the beginning where they're planning, then developing a search strategy, choosing resources and doing their search, screening through all their search results, appraising the studies that they've decided to select, extracting the data, and then synthesizing it all to write and then publish. So in this session today, we're looking mainly at the beginning end of this process, planning, developing a search strategy, and a little bit about choosing resources. But next week, there's another webinar which Jennifer will be facilitating, and that one's going to pick up where I leave off, and it's going to focus mainly on conducting database searches and managing your search results using software tools to facilitate those later stages, so screening, appraisal, and data extraction. So there's a link on this slide to our online systematic reviews guide, which has just been refreshed with a new version which just went live yesterday. So we're just going to have a quick, quick look at that, which is here. And so you can see on this first page, there's an overview, which has that diagram that I had on my slide, has some information about what is a systematic review, which a lot of it I already talked about, and a little bit about different review types, and some of the same review types I talked about are there, and some are a little bit different. But then after that overview page, it goes through each step in the process with a different page for each one. So for instance, you can see that we've got a section on planning, and a lot of this is what I'm going to be talking about today. Then developing a search strategy, which again, I'm going to be looking at. You can see here in choosing resources that we have some sub-pages that address different types of resources or different discipline focuses. So whatever discipline you are studying, there'll be information here if you're conducting a review. And then on to screening, appraisal, extraction, synthesis, writing and publishing, and then links to more help. So I do encourage you to look at this guide later because I think that you'll find it very helpful. So we're going to be working through a little bit more of the planning side of things. So the first thing you need to do is actually develop your research question. So one of the features of a systematic review is that it addresses a clear research question. And the type of question that you need will depend on what sort of review you're doing, and also the type of question you have will actually impact on what type of review you should be doing. But if you're doing a systematic review, kind of the traditional systematic review, then your research question needs to be focused and it needs to be answerable. So we're going to have an example to kind of draw that out a little bit. So suppose I have a topic that I'm interested in, the health impacts of the COVID-19 pandemic. That's not a question yet. That's great that I've got a topic, but it's not yet a question. So let's see if we can finesse it into a research question. So how about this one? What are the health impacts of the COVID-19 pandemic? So I've got a question, but it's too broad. What are the health impacts of the COVID-19 pandemic? Are we talking about mental health impacts, physical health impacts? Are we talking about for particular people? And it's just too broad. And it's really not answerable because how will we find evidence on what are the health impacts? The question's just not specific enough for us to find papers that will answer that question. So I've come up with this one for us to use as our example. What is the impact of stay-at-home restrictions on levels of physical activity during the COVID-19 pandemic? This one's a better question. Still might not be perfect, but it's well focused and it can be answered because there is something that we can measure. So there can be papers written that have measured the levels of physical activity that people are doing. So it's more likely that this question is going to be suitable for doing a systematic review. Luckily, there are tools that can help you write a good research question. So this is just one example of a tool, which is the PICO model, and it's often used to formulate a clinical question in health research. So those kind of traditional systematic reviews that are looking at the effectiveness of a particular intervention. But not all clinical questions or health-related questions fit this model. And questions in different disciplines certainly won't fit this model at all, but there are a range of other frameworks available. So on that systematics review guide, on that planning page, there is a section where there are some alternative models you can look at and they can help you. So using this framework or another framework, it just helps you to think through if your question is focused enough and if it is going to be answerable. And it gets you to start thinking about what sort of literature you'll actually be looking for to find the evidence to answer your question. So will you be looking for randomized controlled trials? So you would be if you were looking at the effectiveness of a drug compared to a previous one or a placebo. That would be the type of research you'd be looking for, but you might be looking to answer a completely different question. So you might be looking for surveys. You might be looking for guidelines documents. You might be looking for reports from government organisations or many other examples. You need to think through what sort of resources will be able to provide you evidence to answer your question. And then once you've got your question sorted, there are some other things that you need to consider. So at this planning stage, it is very, very highly recommended to check to make sure that there's not a recently published systematic review that's answering your question. So there are databases that you can use specifically to look for health-based systematic reviews. So the Cochrane Library and Joanna Briggs Institute are two such examples, but many databases that include research literature include systematic reviews, and there's usually functionality in databases so that you can limit your search to that type of publication. So the answer is to search in databases that are relevant for your discipline. And this screenshot is actually from the Cochrane Library. And when you do a search in there, it provides you your search results in different sets. So you can see for the search I did, there were 14 Cochrane reviews, so 14 systematic reviews that kind of met my search criteria. And there were 2 Cochrane protocols that fit my search, and there were 365 trials. So it's just a useful place to search if you're looking for health literature around systematic reviews. So you might be wondering what that Cochrane protocols is. So you can see if there are reviews in progress by searching the registered protocols. So many researchers that are intending to publish actually register a protocol ahead of time, and you can find them, as you can see here, in the Cochrane Library. You can also find them in Joanna Briggs Institute that I mentioned before. There is an open database of protocols called Prospero, which I'm going to show you. There's the Open Science Framework, and there are other options as well. And there are links to those on the online guide that I showed you a moment ago. Another thing you should think about before you get too far into your planning is, are there some best practice guidelines that you should be mindful of? So guidelines and standards describe a gold standard for conducting reviews. They're incredibly important if you're actually intending to publish your review. So if you're a higher degree researcher and as part of your PhD, one of your years of your PhD is going to be used conducting a systematic review that you intend to publish, then looking at guidelines and standards is very important. Whereas if you're an undergraduate student that has an assignment that is asking you to undertake a sort of modified version of a systematic review, really you should be looking at your assignment instructions and your assignment marking rubric and not worrying so much about these guidelines or standards, which are very, very detailed and may absolutely overwhelm you and not be particularly relevant for you. However, I actually think that these 2 examples that I've got here, which are Prisma and the Cochrane Handbook, are quite helpful to look at no matter what, whether you're planning on publishing or not, and have some good stuff no matter which discipline you're working in. However, if you are a higher degree researcher and you're working in a discipline that is not a health one, you should check with your supervisor to see if there are standards relevant for your discipline. And if there's specific methodologies for your discipline. And we do have some links on the guide to those different discipline resources as well, which I'll show you when I've got the guide open in a little while. So I'm just going to take a moment to have a look at these. I don't think I've previously opened this. So I'm just going to open it now. So this is the Prisma website, and it has a number of helpful documents that you can download, which, yeah, to be honest, I think can be helpful whether you're publishing or not. But again, as I said, please don't get bogged down in this if you're writing an assessment task for an undergraduate or even a postgraduate by coursework subject. Your assignment instructions and your marking rubric are where you really need to be looking. But I really like these documents. So the explanation and elaboration actually takes you through each section of a systematic review and says, kind of, in your abstract, this is what you should include. And here's an example of what an abstract might look like. In your methods section, when you're describing your search strategy, this is what you should include, and this is an example of what one looks like, and so forth. So I think it's very helpful. Also, this little checklist is great if you're publishing. So of course it's opened on my other screen. Just bear with me while I drag it over there. Which goes through, you can sort of tick the box to say that you've done everything. So title, in the title, you've identified that it's a systematic review. Tick. Abstract, it points you to another checklist. Rationale, describe the rationale for the review. You tick it off, and so forth. And there's also a useful flow diagram to help you record how many search results you got from different database searches, how many were duplicates, how many you removed in screening, and how many are left at the end to be included in your review. So I do think that's a useful resource to look at. The other one is the Cochrane Handbook. And this one has step-by-step everything about doing a systematic review up to the extremely high standards of the Cochrane Association. So again, if you're doing an assignment, don't worry yourself about this. But one thing that I wanted to show you is that in this section, searching and selecting studies, I find this really helpful, especially there's a technical supplement, and I just think this is super helpful because it lists a whole lot of different databases that are useful for searching for different disciplinary areas as well. So it tells you different databases, subject-specific databases, citation indexes. It tells you different sources for finding, say, theses, if you're looking for those. Has just so much information in here. It also has a lot of help for search techniques and search strategies, which I think is really helpful. So how to create a good search strategy. And it also has some really advanced search strategies, such as using a filter. If you decide that for your inclusion criteria for your particular review, you're only going to be including randomized controlled trials, then there's a published set of search lines that you can use to ensure that you only get randomized controlled trials back in your, when you do your database searches and other really advanced things. So I think it's a really excellent resource to look at, of course, relevant to your level of study and whether you're publishing or not. I'll just pause there in case there are any questions.
No questions.
Okay, thanks, Jennifer. And also, before you plan your search strategy in detail, you should be thinking about what boundaries you're going to set around your search. And this is all related to what your question is and what sort of evidence you're looking for and what sort of literature will answer your question. So you can decide date limits, geographical limits, language limits, but you need to give a reason why. So it can't be like, oh, I only looked at the last 5 years because when I looked further, there were too many papers and that was too many for me to look through. Okay, that's not a valid reason. But if you've got a good reason for only looking at a certain date limit, for instance, if you're talking about the COVID-19 pandemic, which is a fairly recent thing, and papers from 20 years ago are not going to be relevant, then that's a good reason for limiting that. And you also need to decide ahead of time what your inclusion criteria and your exclusion criteria are going to be. So what a paper has to have in it in order for it to make the cut at the end and actually be included in your review, and what are the things that are a definite no. So as soon as it's got that in it, it's a no, it gets excluded because it's not relevant. And you might recall a few slides ago, I talked about protocols that some people that are intending to publish a systematic review will register a protocol ahead of time. So this is a completely optional step and is only relevant to those people that are intending to publish. So anyone doing an assignment doesn't need to worry about this, but they are encouraged. They help you to stake a claim on a particular research question. So if you register a protocol and someone searches the protocols and sees, okay, that person's already started looking at that question, I'll move on to something else. And it also allows you to conduct your research with this really high level of transparency and lack of bias, because you've actually stated ahead of time, this is what my methods will be, this is my inclusion and exclusion criteria, this is what I'm looking at. So it kind of forces you to be honest. It forces you to conduct that research as you've said, and not just kind of change horses midstream because it didn't look like it was giving you the answer that you wanted it to. So it's just a great way of keeping science and scholarship open and transparent. And they are quite detailed. So this is from Prospero, which is an open register of protocols. So that's why I can show you that on the screen and have it in this recording. So you can see that this one is a protocol that's been registered for a systematic review and meta-analysis of COVID-19 risk among people with asthma. You can see all the detail they've put in. So they've said what their review question is, what searches they're going to do, what types of study they're going to include, what population or participants they're looking at, what the outcomes are they're going to be measuring. And there was much more in it. I've just put a couple of snippets on the screen. So they are quite detailed, but if you are a higher degree researcher and you are going to register a protocol, there is help on the website to go through and fill out the form. It provides you with quite good support on there. And this step, registering a protocol, you wouldn't normally do until you've completed all your planning, you've got all your details of your search strategy and everything ready to go so you can put it in there. But I'm just mentioning it now because from now to the end of the webinar, we're going to be looking in more detail at the search strategy. So I just wanted to show this to you at this point.
I do have a question from Nat.
Yes.
The question is there a standard for scoping reviews and or bibliometric analysis, particularly for discipline of psychological sciences, or is that something that is guided by the supervisor?
Okay, so the Prisma website that I showed has, in fact, I'll go to it, has a section called extensions, which means just extra things that they've done since the original Prisma. So that's this section here. And so they have Prisma for scoping reviews. So if you are doing a scoping review, Prisma has developed the checklists and information for scoping reviews. And you can see that they've also got one for protocols. They've got one specifically for searching. They've got one for if you're doing a diagnostic test accuracy. So if your review is about seeing if a particular test is more or less accurate than another one for diagnosing a certain problem. There's one for ecology. and so forth. And the other part of the question, Jennifer, was around something about psychology, but I've forgotten. Bibliometric analysis, was that right?
Yes.
Yeah, okay. So I'm not aware of a specific set of standards for that, but that's not to say there isn't one. So I would tend to think to go to the American Psychological Association, the APA, because they tend to provide a lot of, resources around the psychology discipline, and they may potentially have some information there, and also talk to your supervisor. Yes. Was that it?
Yes, excellent. Thank you.
Okay, no problem. All right. So now we're going to get into looking for the evidence. So we've thought about what sort of literature we're going to need to find to answer our question. And often we'll be looking for journal articles that describe the results of either a randomized controlled trial or some other experimental study or an observational study. So someone's done a study of some sort, they've published the results in a journal article, and that's usually what we'll be looking for, that we can collect together and synthesize to answer our question. And so usually we will be doing database searching in databases that, that collect scholarly literature, but databases are not the only part. So grey literature is literature that's published outside of that sort of normal scholarly publishing system of journals. So it might be government reports or documents from government agencies, practice guidelines, clinical trials, newsletters, other things. And so often you'll need to conduct web searches or look at specific portals that contain those type of documents. So special websites that collect clinical trials, special websites that collect, say, practice guidelines for a particular clinical practice, so nursing practice guidelines, say, for example. So that will be another part of your search if it's relevant for your research question. So not to forget that not everything is contained in the journal articles in the databases. Hand searching is another one. So this is when you may be asking a question that's quite a specific niche discipline, and there might be some journals that focus in on that topic, or there might be a conference that runs every year that focuses on that particular topic, and you actually go to that journal or that conference proceedings and you manually go through the table of contents of each issue or each year of the conference to look for presentations or articles that will answer your questions. It's very time consuming, but it shouldn't be discounted, and it's particularly helpful if the journal that you're thinking of is not included in the databases that you're searching. So databases are often very large and collect together many, many different journals, and will often do a really great job of finding you lots of relevant articles. But if there's a niche or specialist journal, or if there's conferences that aren't included in those databases, so they're not indexed by those databases, then it is important to go to the source and actually look through them. And the other last one is it's really important to look at the reference list of the studies that you actually select for inclusion, just to make sure there's nothing in their reference list that is relevant that you've missed somehow in your other searching. Because remember that when you're doing a systematic review, you're not just looking for just some of the literature that talks about a particular question. You're actually looking to try and find everything that answers your question that fits your criteria.
I have a question from Jess.
Yes.
How far should you go back to if using hand searching?
Yeah, that's a great question. So you should, this is why the planning is so important in a systematic review. And that's why I'm spending so much time talking about it today, even though it might seem a bit boring. So you should decide that ahead of time. You should decide based on your question when you think is relevant, and then make a decision. And as long as you can justify, hand searching is a very time consuming and laborious process. Literature answering this question is most likely to be relevant from the last 5 years or whatever it is, and you say that at the beginning, then you're good to go.
Yep,
Okay.
all good, thank you.
No problem. Okay, so the first thing we need to do when we're planning our search strategy is actually identify what are the key concepts we're looking at. So in our question, I can see 3 key concepts. So it's the stay-at-home restrictions, the physical activity, and the COVID pandemic. And if you're answering a clinical question, it might be the population or the intervention and the comparison or something like that. But often you'll find about 3 concepts that are relevant that all have to be included in order to answer your question. So the next thing you do is brainstorm some additional ways of describing those concepts. So I've got this table, and you can do this however you like, but I sort of have a table that I keep as a work in progress, and just keep adding to it as I go along. And on the left-hand side, I've got the concepts. So I've got my 3 concepts. And then on the right-hand column, I've got just other words that describe it, and I've just brainstormed those. So for stay-at-home restrictions, I've got isolation, quarantine, lockdown, spelt 3 different ways or with dashes and spaces, stay at home, self-isolation, and you might be able to think of many more for those concepts. But it's important to think about, like, why do we need to do this step? Why do we need to brainstorm additional terms? And this is to make sure that we don't miss any relevant research papers that address our question. Remembering that our goal is to find all the relevant research that addresses our question and meets our criteria. So different articles that are about a topic might use different terms for it, and it's important that you capture all of them, not just the ones that use the term that you kind of first thought of in your question. Also important to think that there are sometimes specialist terms, so you might want to think of like the specialist way of saying it, and then kind of more the layperson way of saying it, include both of those. Or they might be different sort of words used. In the US, they might refer to something differently than they do in Australia and the UK. So that's important to consider. And it's also important to consider if your question kind of crosses across a couple of different disciplines, you might like to think about whether the different disciplines refer to a concept in a different way and use different words. So it's really important to have a range of words for each concept to make sure that we don't miss anything. The next thing we do is we identify subject headings. So please don't worry about the image on the left-hand side of that screen. It is too small, and I've highlighted the important bit in the box on the right-hand side, which is the mesh subject headings. So what this is an image of is from the Medline database, and it's actually the record for that systematic review that we looked at right back at the beginning as an example. And they record lots of interesting things about the systematic review. So the title, the author's names, what journal it was published in, and everything. But one of the value adds that a database gives to it is these subject headings. So what happens is a real person, an indexer, in most cases, reads the articles and decides what subject the article is about. They have a list of approved terms that all have clear definitions so that they can choose the correct subject, and they can make sure that it's on topic and that it's kind of not too broad and not too narrow. It's at the right level of specificity. And so when databases use this, when they index the paper and add subjects headings to it, it gives extra functionality to the database because it means you can search using those subject headings, and then you'll find all the literature in the database that has been tagged, so to speak, with that subject. So it's very, very helpful. And different databases use different sets, so different lists of approved terms for subject headings, so they're not the same across all databases. Medline uses the medical subject headings, which are MESH for short, and other health databases use those too, but some health databases use different lists of terms, and other databases use completely different ones that are more relevant to their discipline. And there are some databases that don't use subject headings, but when you do have them, they are great to use. And next week, when Jennifer does an in-depth search, she'll show you how the functionality of the database helps you to actually find the right subject headings to use. But also when you find papers that are relevant and they've been given subject headings, you can use those ones to incorporate into your search. So here I can see 2 subject headings on that list that have to do with COVID-19. So the one at the top says COVID-19, and the one down the bottom is SARS-CoV-2, which is just another way of describing COVID-19. And I can see there's one in there about pandemics as well. So it gives you ideas for what might be the relevant subjects headings to use. And when you do a good comprehensive search, that kind of fits that really high gold standard of Cochrane and Prisma and other standards, you'll always be including your keywords and your subject headings. So once you've chosen all your words that you're going to use, how are you going to put them together? I'm just going to look at 2 Boolean operators because these are just the foundation of searching and absolutely essential for you to understand how they work in order to construct a complex search. The first one is OR. OR broadens your search. You use OR when you're combining synonyms or different terms or different ways of describing the same concept. So for example, if you combined quarantine or lockdown or stay at home, they're all ways of describing that same idea, then it returns all the papers that use at least one of those terms. So as long as it mentions quarantine or lockdown or stay at home, you bring it back. So in that Venn diagram, everything is shaded in. And the other one I'm going to talk about is and narrows your search. You use and to combine your different concepts, because sometimes there are 2 different concepts or 3 different concepts or even more that must all be included in the paper in order for it to be relevant to answer your question. So for example, if we combine the words lockdown and COVID-19 and exercise, then we only get papers that use all 3 of those terms. So you can see in the Venn diagram, that's just that little bit in the center. And in order to create our search, we're actually going to use OR and in quite a complex way. We're going to put them together to make sure that we're broadening where we need to include all the different ways of describing our concept, both keywords and subject headings, but narrowing it or focusing it where we need to make sure that it includes all our concepts. And there are other advanced search techniques that we're going to use too. There's just a few listed on here because we want our search to kind of find everything we can that will answer the question, but we also don't want to bring back thousands of irrelevant results. So we want to kind of work through, and I will say at this point that searching is an iterative process. So you'll do a practice search, you'll test it out, see what it returns, and then you'll make changes, and then you'll try again and do a few of these planning searches before you kind of nail down what is actually the search strategy that you're going to go with. So the first one I've got on there is phrase searching, and I've put the little quotation marks around it. So this is necessary in a lot of databases if you're searching for an exact phrase. So if you want those words in that order next to each other, you actually have to use usually inverted commas, but in Scopus it's curly brackets, but most it's the inverted commas to get an exact phrase. Now, a lot of the health-related databases actually assume a phrase search when you're doing a keyword search and you don't need them, but a lot of other ones you do. So it's worth pointing out that if you don't include them, so for example, if we had the phrase COVID pandemic and we wanted those two words exactly next to each other, we wanted that phrase, that's only going to bring back results where those two are in that order next to each other. Whereas if we don't include them, the database will search for COVID and pandemic. So as long as the word COVID and the word pandemic are both there, it comes back even if the words are nowhere near each other. So that's an important strategy to know. And we're just going to have a quick look at one of the pages on the guide at some other things. So talked about identifying keywords and synonyms. We talked about subject headings. So the next one is truncation. So this one is to help you find variations of a word. So therap with an asterisk will bring back therapy, therapies, therapist, therapists, therapeutic, and so on, all in one search without us having to do individual searches for all those words. And there are wildcards often in databases. So this one is the example with the question mark for either colour or colour spelt with the UK, Australian or US spellings. Now, these techniques are specific to databases, so not every database uses exactly the same, like asterisks or question mark to mean the same thing, but there's always a help section in a database. It's usually up in the top menu when you're in a database. There's usually a button that says help, and if you click on that, it will actually tell you. I believe we also have some information on this guide that has some details about that. I think it might be in this next one. This is Boolean, which I went through and or for you, but there's another one, not. If there's a word that you really need to exclude and can't have anything with that word in it, you can use not, but I use not very sparingly. This is a great page to look at that explains how you can combine and or together in a search. And this one explains how you can find a bit of a middle ground between not an exact phrase, not the two words being right next to each other in that order, but the words having to be close together. So that's called proximity searching. And in this example, it uses the ADJ with a number, but different databases will be different. And that one, physician, ADJ, relationship, means that they have to be within 3 words of one another. So they can have at most 2 words in between, but they can be in either order. So it'll bring back physician-patient relationship, or patient-physician relationship, or relationship of the physician, and many other. And this is the document that I was talking about that has a little guide for a lot of the techniques in the different health databases for you. Now that is the end of my presentation, and I can see that I've talked a lot. So I haven't left very much time for any additional questions, but I am very happy to answer any. I can see that Ben's got the poll up, and we'd really, really appreciate it if you'd answer this, because it helps us to improve future webinars. So it'd be great if you would go ahead and answer that for us. Is there anything I should be mentioning, Jennifer?
No, Nat had a question, but I answered that through chat. So
okay, great. I might just stop sharing and put my video back on so that you can see that I'm a real live person. Okay, Ben, is that poll working okay? I think I can see some answers are coming up, so that's good. All right, so what I should mention is that, yeah, do go back and look at that LibGuide, and I can see that Jennifer has put the link in the chat. And also remember that if you're a higher degree researcher, you can contact your research liaison librarian for one-on-one help. And if you're an undergraduate or postgraduate by coursework, you can book a librarian. So we have face-to-face appointments at all the different campuses at different times, and we have online appointments as well. So please do not go away thinking that you have to have learnt it all now from that. You definitely have other options to get more information. And don't forget that next week, Jennifer is going to be doing an in-depth search example and continuing us through the process of the systematic review through a few more steps in the process. So I think we'll wrap it up there. Thanks, everyone.